Welcome, everyone, and thank you for joining us again in this PPH interview series. Today, we have a very special guest, our dear Amy Staley. So I would like to ask you, Amy, if you could introduce yourself in a minute with our audience.
Absolutely. My name is Nurse Amy. I am a proud registered nurse at New York Presbyterian Hospital, Weill Cornell Medical Center. Miss Amy, an advocate for pregnant teens in foster care, and Amy Staley, a global health advocate, co-chair of the Nursing Now Challengers Committee, America's region, and an immunization advocacy champion. I am also a soon-to-be master's degree graduate of Columbia University. And I also sometimes refer to myself as the CEO of Tucking You In with a Warm Blanket, COO, Chief Optimism Officer, and Editor-in-Chief of the stories that I share through my activism and advocacy work.
Thank you, Amy. That's amazing. I love all the titles that you have been working on years. And I would like to start this conversation, Amy, asking you a little bit about when was the first time that you started to think about getting involved with healthcare?
Yeah, so I was raised by a single mother in Newburgh, New York, who taught me just to believe in the power of my own voice. And she advocated and cared for my father, actually, as he was dying from cancer. And although, the result, he wasn't really healed necessarily, through watching her heal the hearts of everyone around her and heal myself and my brother, I just felt so empowered by her. And I really just learned the true meaning of the word selflessness. And so much so that I chose to create an entire career out of it. I decided to go to nursing school. And throughout nursing school, I worked with pregnant teens in foster care. So in this role, I advocated for the needs of the teens and their children. I taught the teens things that they wouldn't learn in school, like how to build up a resume, how to take care of children, how to look up if the person they were talking to from school had a criminal record, like things that, other people might not be able to teach them, and really just advocating for their needs. And a lot of them grew up in abused households and had never experienced love for themselves. And so, how are they supposed to raise a child in a loving environment when they had never felt it themselves? And they taught me a lot too. They taught me a lot about the idea that respect is not just given, but rather it's earned. So at the same time, I earned my nursing degree and I began working at Weill Cornell Medical Center, where I was blessed with the most incredible gifts I could have ever gotten, my coworkers. And I was tapped on the shoulder by an incredible leader there, Miss Rhoda Radula, who invited me to join the Nursing Now network. And from there, all these leadership opportunities just kept pouring into my life. And I applied for this initiative to gain funding for COVID-19 vaccinations through my community of New York. And I had the opportunity to benefit two nonprofits here in New York City, one a local harm reduction center, and the other actually the same foster home where I had earned that title of Miss Amy. And through that opportunity, I also had the opportunity to take the most incredible storytelling course at People Power Health, something that aided my voice in reaching over 150 countries virtually, and very recently in person at the United Nations General Assembly. And throughout this work, I knew that my voice was impacting rooms that I had yet to enter myself. And now suddenly I was in these spaces, actually talking to policymakers and political leaders and just speaking on this platform. So through my activism work, I've been working to heal not only my patients, but the entire nursing profession as a whole. I think there's a lot of work to do, and I want to ensure that both my fellow nurses and our patients are heard and represented in these spaces, whether they be big or small.
Thank you for that, Amy, and especially also thank you for mentioning about the opportunity that we had on practicing public narrative together and working on our stories. But right now, I would like before we go into that area, I would like to ask you a little bit more about your experience during the COVID-19 pandemic, because I have very clear memory of when we were doing our training that you share with us about your story of self and how during those first weeks and those first months of the pandemic and the lockdown, there were a lot of different struggles that you were facing with your colleagues. So could you tell us a little bit more about that?
Yeah, absolutely. I think that one really special thing that the COVID-19 pandemic taught me as a nurse is that it's not like ventilators and supplies that make an ICU, and it's not, medical supplies that make a hospital. It's really the nurses. I know one challenge that we faced was having enough critical care beds and having enough ICU beds. And so we opened up different areas. We created ICUs in our PACUs. Our critical care nurses ran their own crash course that was, nurse created and nurse driven to teach those of us who hadn't cared for such critical patients. And that was just really so special, just seeing the camaraderie and seeing the unity of all of the nurses together. We definitely faced challenges, but we had really supportive leadership. And in that sense, we were kind of able to overcome everything. I know recently I was talking to somebody about the COVID-19 pandemic, and they were saying, there's one theme that always gets kind of brought up, which is death. And that's not something that I necessarily focus on as an optimist, but it's kind of like the elephant that lingers in the room, and, that heaviness that a lot of nurses still feel. And I think that the more that you allow yourself to feel those things, the more healing that you'll have. One of the biggest challenges I faced during COVID personally was traveling to another hospital hotspot for 3 weeks to assist down in Florida. And being a nurse there was certainly challenging with short staffing and short supplies and seeing so much. But honestly, the hardest part for me was the uncertainty of afterwards, like the unknown, and not getting to see the outcome of how these patients did. Like, I'll never see them again. I have no idea, how things turned out. And I actually, when I got home, I bought a bunch of plants. And I named each plant after a patient that I had cared for down in Florida. And I ended up with way too many plants. So I ended up giving them away to neighbors and friends, because it turns out I'm a lot better at caring for people than plants. Definitely don't have a green thumb. But in a sense, I found this sense of healing in that, because I still find satisfaction in knowing that somewhere, those plants are growing, and I am also still growing.
Thank you for that. And yeah, I mean, definitely I can totally relate to that known part of what happens next after we finish our work and our activities with our patients. And at the same time, I would like to go back to a word that you mentioned just a moment ago. That's hope. So what's your personal opinion, Amy, related to how being an optimistic and also being a healthcare professional that sees all of the different needs and all of the different challenges that we face during our daily shifts, how can we focus on the hope that we can either give to our patients or share with our colleagues?
I think that to focus on the hope, the first thing that we need to realize is that anything that we can think up, any kind of project or research, is attainable and achievable. And really, that's the message with hope. Health equity being a big theme. I think that health equity is achievable, but it's going to take all of us to do so. Looking at socioeconomic disadvantages, recognizing health disparities, and tackling those things head on, talking to policymakers, government officials, having open-minded leaders that seek out the opinions of nurses and really just value their voices. Healthcare is a human right, and we definitely need a healthcare system that will benefit every single person who seeks care. And we can't stop seeking out that until we have it. And I think that anyone who works in science, whether you're an allied health professional, a nurse, a doctor, a scientist, a researcher, like, we know firsthand how amazing and how hopeful and complex the human race is, right? Like, we figured out how to match up blood types, have people donate blood, give it to somebody else, transplant organs and give people second chances at life, deliver life itself, and then celebrate it every 365 days with a silly little song. Like, if there's one thing that we know how to do, it's how to find hope and how to create joy. And we can certainly figure out a healthcare system and find health equity that works for everyone.
Totally. Thank you for that. And another topic that I would like to mention briefly, Amy, is when we are focusing on these concepts on health equity or health inequalities or maybe social determinants of health, etc. Sometimes there are some topics that we can work with or that we can see that are more like invite us to get involved with them. Maybe some people are more inclined towards the impact of climate crisis on health, or maybe some other people are more focused on how poverty affects health. So out of the different topics, you mentioned some of the areas where you have been an activist in the recent years. Can you maybe briefly mention us one or two examples of some topics and how you got involved with them?
Absolutely. So one thing that I'm focusing on right now is the recruitment and retention of nurses. I think that all nurses would agree that you can't recruit if you don't retain and recognize. And so I think that those things are really important. So really just finding things that I'm passionate about. Another thing that I took up a recent passion is through this whole Nursing Now challenge and through taking this course through People Power Health and getting to connect with the World Health Organization, I've realized like all of the disparities and challenges that nurses face around the world, not just in my community here in New York. So like one thing at the United Nations General Assembly that struck me so hard was finding out that only 14% of community health workers in Africa are paid. And, that just really shocked me. And knowing that more than 1/3 of nurses plan to leave their roles in the healthcare professions towards the end of 2022. And progress to me for that would be like retention and seeing that nurses are feeling valued. And that you're making an impact when you see that your work is affecting and benefiting everyone. And that's what we need. We need to see everyone represented. And that's really like what equity means to me. In the hospital, there comes a time when you say, we've done everything that we can. And when you say that in a hospital, you have to mean it. It's very significant because usually it's in regard to a human life that's in your hands. So when you say it in advocacy, it's just as significant. You should mean it every time you say it, that nothing else can be done. And you may not be able to see the outcomes as clearly as you would in a clinical setting, but someone's livelihood very much might depend on your efforts. And so it's important to just maintain what you're doing and keep at it, no matter how difficult it might be.
Yes, and now that you were just mentioning that those numbers about just 14% of community health workers getting paid. Actually, I was reading an article earlier today that mentioned exactly that topic, and they talk about how the difference that could make on the community health workers to get that recognition and that support will be incredible. So my next question, Amy, will be, out of these different topics and out of these different areas where you have had an opportunity of working with, which one of these will you share with our viewers about how some people may get involved in some shape or form? I mean, I'm sure there are plenty of organizations and plenty of projects that could appreciate support. But if maybe we could mention one or two that people could listen to and could look for after looking at this interview, what will some of those could be?
Yeah, absolutely. There's so many good organizations out there right now that are doing so many good things. If you're looking to use your voice, I would definitely recommend taking up a professional storytelling course, such as People Power Health. Sabin Vaccine Institute has so many opportunities for nurses. Nursing Now is the best place to start. There are so many opportunities for nurses to get involved globally and have your voices heard. And it's really just such a supportive network. And honestly, like finding a role or a position that gives you joy and gives you that sense of hope to maintain. Yeah, and there's a lot of other organizations. I could go on and on. Johnson and Johnson, Mothers to Mothers is another great one. Community Health Workers Coalition is incredible. They do so much incredible work. So finding something within your local community, I would definitely recommend, and finding something that you want to change. The whole nursing profession is based off of change and humanity. Like Florence Nightingale, the founder of nursing, wanted to change infection rates and improve patient outcomes. And had she not done that, our profession would not be where it is today. And really, we care for the greater good of humanity. We advocate for our patients to get not only what they need inside the hospitals, but within the entire healthcare system. So definitely working towards like universal health coverage, advocating for justice, equality, equal opportunity to access and care. And, no one should ever fear seeking care. Nursing is the world's most trusted profession for over 20 years. And if there's anyone that has the power to make a change, it's us. And if there's one thing that I've learned from speaking in these spaces, it's that people want to help us. These organizations, these big leaders, they want to support nurses and they want to help us. They just have no idea where to start. And so it's up to us to let them know and to teach them. And it's our job to teach them basically how to treat our profession.
Exactly. And now that you were mentioning Florence Nightingale, I like to ask a couple of extra questions when we are having these interviews. And maybe I should start with those questions now. Which person would you consider that it could be kind of a hero for you? It can be the person that is alive or that is already dead. Someone that you would love to invite to have a cup of coffee or a cup of tea and have a conversation. Who would that be?
Yeah, I think I have quite a few, but if I had to pick my top 3 heroes, I would first pick my mom. She is the original person who taught me to create healing in these spaces where it didn't exist prior. So she would be my second would be Michelle Obama. I think she is an incredible leader. I think that she has such a great impact on young women specifically and encouraging young women to continue their educations. There was a point in time where I wasn't even sure if I was going to graduate college, and now I'm about to do it for a 3rd time. So I think that, she's so empowering, and I just think that her impact is immeasurable. And my third would be Miss Rhoda Radula. She is a nurse leader at my hospital, New York Presbyterian Weill Cornell. She is an author and an advocate, and she holds such a high leadership position, and her impact travels globally, but she still has that human ingredient that a lot of people don't have. And she'll always make the time to, connect with nurses personally and advocate for them personally. And that's just so special to me. It's something that, is incomparable to anybody else.
Amazing. Thank you for that. And my second question is there any specific book or maybe a movie or some kind of media that you find inspiring and that you could share with other people? Like, you need to read this book or you need to watch this movie. Is there any example like that?
Yeah, I haven't read any really great books recently. I did read one. I read Being Mortal by Dr. Atul Gawande. It's about life and death, and it really just emphasizes the importance of humanity and focusing on living a good life before it's over. So I definitely found that to be pretty inspiring. And it reminded me of the importance of advocating to ensure that all of our patients are provided with equal opportunity to heal in a nurturing environment. And yeah, I'd like to write a book someday. So maybe this is me speaking it out into existence. But if anyone has recommendations, I'd love to hear them too.
Amazing. Thank you. And we will be very expecting that book in the coming months or years. And okay, we are getting toward the end of our time for this interview, Amy. But I would like to ask you maybe two last questions. So first of all, People Power Health, we are launching in just a couple of weeks a new program called HEART, okay, the Health Equity and Reflection Training. And we are really, really interested on listening to the voices of health activists that we admire as you. And what could you tell people that are healthcare professionals, clinicians, and that they want to get involved in health activism? What will be your message for these people that are thinking about getting involved with activism?
The best advice that I would give to anyone looking to get involved with health activism is to remain true to your own morals. Don't let somebody else's discomfort or fear of judgment from somebody else push you back into silence, and find leaders that support you in these initiatives. Go where you're celebrated and find, that optimism and that sense of hope. It's worth your time every single time. If it impacts anyone, even just one person, then it's worth your time. And that's why we do it. We make time for this work to invest in it and to invest in the livelihood and equity of others. And you might come across people that are pessimistic. And my best advice for that would just be to be patient with people. Maybe they have yet to meet someone as amazing as you, and that might take some time to get used to.
Amazing. Well, with this, we are getting into the end of the interview, Amy. I really, really, really appreciate and thank you for joining us today. And we will keep in touch. We will keep track of the next activities that Miss Amy is doing, and that book that we will be expecting. That
You
in the
guys will
coming
be the co-authors.
we will love to. So thank you again. Thank you for joining us, and thank you everyone for following this interview series from People Power Health. Thank you.
Thank you.